In general, when I'm looking at a patient with hip pain, I usually want to evaluate them really from head to toe. Because one of the things about the hip is that it can be affected by what's going on in the low back. In fact, some of the hip flexors actually start in the low back as they go down to the hip. But it can also be impacted by what's going on in the knee and the foot. And so sometimes we have cases of hip pain that can actually be helped by treating the foot or by treating the knee. So with hip pain, it's really important that we look both above the joint, below the joint, and of course at the hip joint itself. Also, we want to look for instability in the joint. Where that ball and socket come together, the ligaments hold the bones together. Over time, those bones can start to move a little bit more than they should. And if that starts to happen, especially if we catch it early on, we can go in with regenerative medicine. We can do things like PRP, prolotherapy, at times even stem cell treatment to try to strengthen and tighten the ligaments to provide the stability that the hip needs to let the muscles relax, help the tendonitis to resolve, help the bursitis to resolve, and get the normal pain-free range of motion back in the hip. Stretching can also be a key in helping with hip pain. Oftentimes, again, because of our sedentary nature, the piriformis muscle, the IT band, the psoas, among many other muscles, can all become very tight and shortened. And so these short, tight muscles can become very irritated when we start to use them. And so oftentimes we can treat that with a physical therapy or by introducing some very specific exercises to your exact muscle imbalance to help you restore the normal range of motion in those muscles, which will then eventually lead to getting rid of the inflammation without the need for the anti-inflammatory medications. In terms of my approach to hip pain, oftentimes I like to look for the instability because that can be such a big factor in helping to slow down the advancement or progression or even beginning of arthritis. The addition of osteopathic manipulation can be outstanding. We can work on the muscles, the connective tissue, and make sure that all of those tissues around that joint are able to move freely, that the joint is able to function as well as it can and give your body a chance to heal that region. Acupuncture can help with the body's natural painkillers. It can help with the tight constricture in the muscles. It can help increase blood flow to the area. And so these treatments can be very effective in addition to things like physical therapy and other exercise routines that people need in order to get their range of motion back in their hip.